Okay, that's welcome, everybody. Yeah, we are live actually. Right. Welcome, everyone. Good afternoon on a Friday. This is Dr. Ashish here. I am live after I think a couple of weeks. Was busy with clinic and patients, so sometimes it doesn't happen. But today, again, back for our live show for Friday with another expert guest, Dr. Janine, right? Um,
I like
and she was going to tell us what she do. Even I'm meeting her for the first time, and we were waving at each other without the sound.
the joys of.
Welcome, Janine. Welcome.
Thank you for having me.
You're
Well,
welcome. Please, yeah,
mhm.
please talk. I think there is a little bit of lag here, maybe.
Yes, I think there is a bit. Well, my name is Janine Fari, and I'm known as the Life and Soul Doctor. I am an integrated medical practitioner specializing in nutritional therapy, psychology, frequency medicine, and spiritual healing techniques. So like to look at people in a holistic way, very similarly to you.
Right. That's fantastic because that's also something, as you know, I do as well. Similar, a lot of things overlap. So tell me, what is the frequency medicine you said?
Well, this it's called AO scan. It's devised in America and it uses bioresonance, electromagnetic signals, and
Yeah.
frequencies basically, and it analyzes the body by
Hmm.
shooting frequencies at it, comparing it to the blueprint of what is healthy and normal. So it
Yeah.
detects imbalances and then it corrects it with frequencies.
Right. Yes. I was actually reading about it last night as well. We have got another method that in Ayurveda we use, which we have used for centuries, called Nadi Pariksha, which is the pulse diagnosis. And pulse diagnosis now, there are some equipments out there which is based on the bioresonance model to check from your pulse and assess your whole health. So I think it is very similar to that. So that's wonderful to know. And where are you based, Janine?
Well, I'm originally based in London, but I travel a lot now and I do a lot of work remotely. So I could be in Toronto, Malaga, or London, depending on what my schedule is like. Because I see patients individually, but I do corporate workshops and all kinds of things. So London and
Okay.
Spain mainly.
Right, right. So you are traveling to speak mainly or also to see patients, like you have clinics in other parts of the world?
Yes, I think I am my mobile clinic, so it's wherever the demand is, and I like to travel and meet people. So
Yeah,
I always seem to attract people as I need them, and they need me.
yeah, yeah. No, that's wonderful because I do that as well, traveling to France, to India, to wherever patients are. So I do similar thing. Not that much to US or Canada, but to this side of the world, Europe and India is more, or Middle East as well. So great for you to be here. Tell me, how did you get involved in frequency medicine? Holistic medicine. Where did that idea come from, or what has your journey been like?
Well, it's very new to me in my clinic. Only been using it about a year and a half, but I heard about it from somebody in London, and she said, "Oh, if I had all the money in the world, I would invest in this particular technology." So I'm
Hmm.
thinking, well, I'm interested in the technology, and the money will come if I'm meant to do it. And so I just started doing it. It always starts with analyzing the voice because
Right.
the voice gives you and the Mayo Clinic have done studies on this, how your voice is a mirror to your emotional health. And
Yeah.
as we know, 95% of disease comes from disease emotionally. So
Hmm.
the software always starts with analyzing a person's voice, and it will detect which emotions are out of balance, the first three most significant ones. And then the fourth one is the one that is suppressed or the person is trying to avoid.
Mhm.
Um, and then not only will it detect the emotional imbalances, but it will then generate, they're called balancing harmonics, which are essentially frequencies that are healing and they're accompanied by music. And you just listen to them at minimum of 5 minutes a day. and the more you listen to it, the better. And I've had astounding results with it. People sleep better, they're more relaxed, less
Yeah.
anxiety, pain relief. It's quite incredible. And then,
Hmm.
in addition to that, you can then do various scans on the body. There's the vitals, which is similar to a blood test. There's the comprehensive, which includes the musculoskeletal system, immune system, digestion, everything. But it will, in 9D, it will pinpoint a muscle that's out of balance. It's quite incredible. You can do
Hmm.
your jaw, everything. They're
Wow.
using it, yeah, they're using it in ERs in America. It's very big in America, but they are
Right.
usually more advanced than us.
Yeah, yeah. No, I've known about this for some time, and I don't use that in my clinic because we use other traditional methods of,
Yes,
that as well. But I agree. It is how can we heal with energy, basically, frequency, and frequency can be tapped into in lots of different ways, like sound energy. Sound healing is also frequency healing, right? And then we do in ayurvedic medicine, we do chanting, for example, which I do with my patients. Chanting is similar thing because we are trying to create that healing vibe. Affirmations are the same when you are chanting mantras over and over again. So we have done that thousands of years, and now we have actually a machine which can do that. And I also know there are electromagnetic beds that people are lying on to get into healing frequency, all of that stuff, which is all leading into being healthy. Eventually the idea is that.
I think it's a combination of ancient wisdom with modern technology. And that's the beauty of science. It's always evolving, and the old message should definitely not die. And I love that you do all these different things, particularly as your specialty is fertility, because it's such a complex area.
It, it, it it's really is complex. It's also because it's not just one person, it's two people involved in it, and
Yes.
then how women's health is right now, and the fact that I modern medicine is not really looking much into women's health, and especially fertility is, I don't think it's a really highlighted area as such. We are not really bothered about it because it's like, okay, yes, you can't have a child. It's not the end of the world as far as medicine is concerned. If you don't have cancer, if you don't have any major health condition, then yeah. So it's not priority because we know this even here in the NHS. It's not a priority, and there is a huge waiting list. Even to see a gynecologist, there are 4, 5, 6 months waiting list. The fact that we don't look into this, but anyway, I don't just want to talk about fertility, but it is a huge issue that we have for women's health.
I think the other issue, of course, is the menopause. It's only just starting to be talked about now, and it's thanks to celebrities that they've kind of normalized talking about it. But it has a huge impact on a woman, but also her marriage, her relationships, her work, her identity. And I think it's the same thing with the fertility because a lot
Yeah.
of women might feel a failure. It affects their confidence, their self esteem. It's not just a medical issue, it's a psychological one as well.
No, and I think that's where the integrated idea of integrated medicine comes into it. That health issue is not only a health issue,
Of
health
course.
issue is a social health issue. Health issue is a relationship issue, as you mentioned rightly. Infertility, most of the time when I see patients, they are at the verge of breaking up, because it's a really stressful time for them. And of course, one blames the other. Wherever the blame lies, there's nothing to be blamed, but that's how we human beings are. If it's not my issue, then I'm looking at other person why they are not fixing their issue. And it is, even with menopause and everything, yes, it is being talked about now, but also there is a danger that we are medicalizing it too much. What has happened with fertility also, IVF is such a medicalized version of using medicine for women for fertility, that we are putting synthetic hormones daily for not just for weeks but months on end. I spoke to a patient yesterday, and she said she has had how many cycles? 5 cycles. 2 cycles for the first baby, and now trying for the second. Already had 5 cycles, failed.
I think it's also the other thing is it's given there's such a huge demand and people are very enthusiastic with that demand. There's also gives an opportunity to be abused because
Yeah,
then becomes a commercial enterprise. A bit like we can think to look at Michael Jackson. You know that was open to abuse because they destroyed him in the end. You
yeah,
know they didn't use any kind of ethics with him or just say no enough.
yeah.
And I suspect with IVF it can happen. People are desperate and they're meeting a demand.
True. I mean, doctors are saying that yes, they are doing it. I also feel that people are not informed. They think that IVF is this golden magnet that once they have it, it's like it's 100% sure shot to have a child. And we only know the success rate of IVF is 30%, 35%, maximum 40%. So it still has 60% failure rate, and we are not addressing that. We are not addressing that with any natural medicine, any integrated medicine, bioresonance, you name it. Why are we not doing any of that? And that is one of my reason to do this live talk as well, so that we can talk about more about integrated idea of using medicine you know
Yeah. And I
if
love that.
yes, so if we tell me if you also think the same way. But I think if even if you have to use, say, IVF, even if you have to use for menopause, you have to use HRT, but there are so many things naturally you can do. You can use bioresonance, you can use sound healing, you can use Ayurvedic therapies, you can use nutritional side of things. Do everything and use small part. HRT should be a small part of that, or IVF drug should be a 1% part of the whole holistic health. But it is not like that.
No, it's not. But I think the problem is few people are integrated and holistic. I mean, I know from my own experience with medicine, and I work with wonderful doctors. And the doctors I work with are very open to complementary medicine. And they'll have people on the list for surgery, and the person is a bit wary. I work with the London Spine Clinic in Harley Street, and he'll say, no, get some weight off, get the inflammation down. And I can't tell you how many people have avoided surgery from trying other things.
Yeah.
It's not the answer to everything.
No, it's not. So no, so we are on the same page.
Very much so.
Yes. So how did you where did you originally start with? So how long have you been being a life soul doctor?
Well, I started with a degree in psychology, and I did that at Royal Holloway, University of London. And I always was very interested in the human mind, but I ended up in a commercial context of working in public relations, marketing, and I enjoyed it while I was very young, and it was parties and lots of luxury. But I found it was quite soulless. I kind of felt that I had, other things that I needed to do. And as a child, I always wanted to be a doctor, but that didn't happen originally because I had been sick. And in those days, they didn't care for sickness as they do now.
Right.
Um, so then I ended up doing a degree in nutritional therapy, which was at Westminster, 4 years with clinical practice.
I
And then I
studied in University of Westminster as well.
did you? Oh,
Yes,
which one? Because there's different campuses.
yes, yes. This is the campus in Good near Good Street.
Oh,
Um,
yes, that's it. That's where I
yes,
was.
I studied herbal medicine at University of Westminster.
Oh, wonderful. So we probably know a lot of the same teachers.
Yes, which year were you in?
I was there 2003 to 2006.
Oh, I was there 2000, from 2000 to 2003, 4.
So yeah, there's a,
I was
I'm sure,
coming out and you entered.
yeah. Yeah, because in fact, our the course leader Heather Rosa, you may know her, the name. She was very much into the phytochemicals, and she insisted that we did lots of plant and herbal medicine as part of our degree course.
Yes, 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 yes. Oh, how wonderful. We are
Yeah,
alumni of University of Westminster.
yeah, it's wonderful training.
Yes.
Wonderful, wonderful training.
Well, herbal medicine course is not there anymore. It is not running now. We don't have any degree in herbal medicine, but it was a wonderful course when it was there.
Yeah.
Yeah. So excellent. So you started from there, and then what
Added bits.
kept added on? Like
Yeah.
me, I kept adding on.
Yeah, I mean, there are people that will say, "Well, you're a jack of all trades, master of none," but all the trades work cohesively. And I just believe that when you look at a person, obviously we have to look at their biochemical individuality, but also they have different needs, not
Yeah,
just from their makeup biochemically, but as people, they have different needs, and some will be receptive to some techniques and others won't.
that's right. That's when I start when I started Ayurvedic medicine in early days, 30 years ago, and I thought, oh, this is the best medicine in the world, which it is. Um, but I've realized over a period of time that even if it is the best medicine, the person may not be in the right space to receive that. So they may connect more with bioresonance. They may connect more with entry point could be nutritional appointment. So I think wherever people connect, wherever their own energy is, also, everything comes into play: finances, budget, their time, their other resources, and wherever they are in the world as well. So there are parts of the world where Ayurveda is not even heard of, let alone having anything with Ayurveda. So, same with other natural medicines. So, yeah, I agree with you. It is kind of attacking from every side, or kind of supporting from every part of your health.
Yeah, definitely. That's one of my dreams actually, to go to Kerala and go to a really good Ayurvedic center for a couple of weeks minimum and just be pampered and restored. I would love that.
Well, we are taking a retreat next year, so you are more than welcome to join us.
Yes, please let me know.
Yes. So that's wonderful. And what kind of people do you work with?
All kinds. I mean, I would say generally women seem to approach me more than men, but I do have a lot of male patients as well, and particularly young men between
Mm.
20 and 25. I seem to get be a magnet for them,
Ah,
which I like. But that's usually more for kind of talking therapy because men don't tend to talk as much as women, and
yeah.
I think they like the fact that I'm pretty down to earth with them, and it's a conversation rather than a therapy session.
But that's really interesting because that's a very young age range in which we don't see men or kind of really young men who are talking about it. Yeah. So they're coming for counseling sessions or psychotherapy sessions.
Usually, the parents that they can sense something's wrong with their child, and then they'll say, "I'll go and have a talk with her," and then that's how it starts. But I
Right.
think people come to me kind of, they'll say, oh, I'm coming to see you for high cholesterol. But in fact, they're in a very unhappy marriage, and that's why the cortisol's high. And well, we know that it's always a front.
Yeah. Yeah. Well, that is always the case, because what is underlying emotion, what else is happening in their life. I see that a lot in terms of sexual health, for example. There are so many issues that people have, which is again something people don't speak about enough. And they may come up with the physical manifestation of backache, lower backache, something else going on. But actually, when you start to peel off the layers, you realize what is going on internally. And relationships is a big part of it, which includes intimacy, how
Oh,
people are.
and
Yeah.
that's the main factor there will be self-esteem, confidence, anxiety, childhood issues, and that's
Hmm.
why I really like to get to the root of issues with the patient. I do another technique which is a bit out there, but it works. It's called spiritual response therapy, and
Okay.
it basically you delve into the person's subconscious to work out what programs they're running which are
Hmm.
impeding them from living their best life. And it is literally transformational because they literally have a map of what is wrong, what was wrong, because I like to put it in the past tense. And then they
Yeah.
have personalized affirmations to help kind of integrate the work into their conscious mind every day.
Hmm. Hmm. And how long is typically, how many weeks or months? do you work with people?
Well, I don't have a typical because somebody might come to me for digestive issues. We'll do the comprehensive stool test. We'll see what's going on. They're
Yeah.
prescribed the appropriate nutraceuticals and they're on their way. Others, so I've had one patient since 2006, and she says to me that no consultation has been the same. But I've known her over such a period of time where she's got married, she's changed jobs, she's had cancer, she's lost her parents. So there's been a lot going on in that time. And I suppose for her, I've been that one constant that
Hmm.
knows what's going on. Her health has altered over the course of time. And yeah, so I don't have a
Great.
fix because it depends on what the person needs.
Yeah, yeah. So you become like their, as people used to call before, family doctor, like I am to so many of my patients.
I suppose um,
Yes,
it's
because you
lovely.
start with one thing, like with fertility. Now, people who came for fertility issues, now their children are growing up, and then kids start to come as well, so you become like their family physician.
Yeah, and I love that. I love that personal rapport, and I enjoy that with all my patients and clients.
Yes, I think that is part of the healing process as well. When people trust you, patients trust you, is where the healing comes from, you know. And whatever suggestion you will make, it becomes even more impactful, more powerful because they're listening to you. And also, they know that you are listening to them as well.
I think also they know I work with integrity. I don't try and sell them things or push them onto things. I just say, look, these are things I think it would be helpful. Have a think about it.
Yep.
Um, because again, I don't want it to be open to abuse or commercialism. I really want it to be appropriate and a patient-centered approach.
Yeah, 100%. We got to do what is the best thing for that particular patient in that particular scenario. It is not about anything, could be the best thing depending on how it is suitable for that person.
And
So as
how
I
open
was saying,
they are as well.
sorry.
How open they are.
Yeah, yeah, 100%. And what is your own personal health story, as an individual, as a practitioner?
Well, as a child, I alluded to it earlier. I was sick. I had osteomyelitis, and I was very sick as a child and ended up in a wheelchair. But then, as I grew up, I had a hip replacement with wonderful help, and so I was always interested in being a doctor, but at the time they didn't cater. I was technically disabled. They didn't have the facilities. And
Right.
even the dean of students said to me at the time, you'll never be able to cope with the training. So I kind of abandoned that dream at the time. But it's ironic that all my working life, when I moved on from the kind of luxury PR, that I ended up working for health accounts. And
Hmm.
uh, and then I did the psychology and the nutrition, and here I am as the life and soul doctor. So I got there actually,
You did. You
with the
did.
roundabout route. But yeah, I mean, I've had health issues, and I think that helps to build empathy.
Yeah.
It also means that I'm constantly researching all the time for myself and others.
Hmm.
I don't profess to be a paragon of virtue. I'm very real. I love my food, and I would prefer to eat a cake than run a mile. But I realize that you can't do that every day.
Yeah.
So
Yeah.
yeah, I think healthy for me is about balance and moderation. I
Hmm.
don't agree with neuroticism.
Yeah.
And I think a lot of people can get very neurotic when it comes to health, with food and with exercise. And I don't think that's healthy either. I think you should have a balanced life where you enjoy your food, you have exercise, you have a
Yeah.
good social component, you're emotionally healthy, all of those things.
Yeah, I think no, that's wonderful that you're feeling better than before, and up better and better every day, and optimizing your health every day as well.
Yes.
Um, you know and it is, yes, you're right, it is about balancing. If you have one cheat day, then next day you got to be good with food and other habits, right?
Good.
But because you can't have cheat day every day, otherwise health will not support you, oh, your health will not feel supported by your choices. But I'm very similar. It is, I don't give any idealized advice to my patients. I do idealize advices in the books. That is, if everything in the world is right, and then you are able to do that. But we live in real scenarios. We have real life to live. How can you make the best choice possible? Within those circumstances is what I always recommend people,
Yeah, and
and
also
that is, sorry.
planning is so important as well. If you fail to plan, you plan to fail. So, I often have this with patients if they're going to be traveling. Well, let's have a look at how we can plan ahead. What snacks can you take to make sure that you balance your blood sugar? Um, I think planning is obviously very important as well.
Planning, 100%. Without planning, we can't do, even with our own lives. Like, I have younger kids, I've got twins who are 16. And then if you don't plan, it's not going anywhere. And with that, you can, yeah. And also that we are busy business women, and we are running our businesses as well as looking after the household, whatever that may be. That may include whether children or pets or husband or other family members, and that is, I think, where people need to be supported to make those choices. That's the key part. Everybody knows the information. It is how they can implement that information in their own set of circumstances.
It's also about prioritizing as well.
Yeah.
I mean, and just because you and I walk the talk, well, we talk the talk all day, doesn't necessarily mean that we always walk it. And I have to literally schedule time in my diary to make sure that I have that me time to refill. Otherwise, you can't give. And
No.
there've been many a times that I haven't had that balance, and the repercussions are that I'm stressed or burnt out, and that's not healthy either. So
No.
you learn to, and I'm sure as a mother with twins, you've had to learn that lesson. My sister's got three children, so she's definitely prioritized them in
Yeah,
getting
yeah.
on now.
You got to learn to prioritize 100%, and you have to put your own, what is it, mask on first.
Yes.
Self care and look after your health. Whether you have children or not, people still have busy lives. And as a business person, you still have other things to do. And you're right, without preparing for that and prioritizing your own health. And it is so, so crucial for women especially to really prioritize, because what I have seen, as personally my experience has been, uh, when kids were younger, you just, as a parent, cannot take a day off. There's just not a day off.
No.
Even if I am sick certain day, which I hardly am, you still have to get up. I still had to get up and feed them and do everything else. So it's better to be healthy so that you don't have to drag yourself out. So yeah.
Even in marriages, it's as much as you can have wonderful men as husbands. Usually, because we are more predisposed to that. Our wiring is we can multitask, generally. And even there's the joke about the barbecue. He'll say he did the barbecue, but the woman has gone out and bought all the food. She's done all the marinade. She's made all the dressings and all the salads and all the things she's thought of to make it a special occasion. And he's put the meat on the barbecue, literally, but he's done the barbecue.
Yeah. Yeah.
So I know this from patients. They're just like, God, we have to do everything. Even if he's looking after the child for the day, she's prepared the bag with all the nappies in it. She's done all the food. No, she's made it easy for him.
It is. It is. Absolutely. I think, yes, I think men are also rising up to the tasks now. It's much better what I have heard from the, women friends who are older, and how it used to be also from farmer friends. And they said, oh, he's at least changing the nappies. So, in our days, they didn't even know what nappy was.
Yeah,
Yeah.
definitely. Yeah.
So, so tell me, a little bit of discussion about what is energy medicine. How do we explain that to people? Why is it important? I do that as part of my work. I am also trained in spiritual healing and Reiki, and which I incorporate. I don't do that separately. I don't give consultations of, healing separately now, but it is all part of how I do therapies. So how do we explain this to other people? What do you say?
Well, that's such a good question. And depending on the audience, I mean, I suppose at the most basic level, everything is energy.
Hmm.
We are talking together via energy. We are dialing into each other's energy. And the example I often give is that sometimes you can think about someone and the next thing they call you.
Yeah.
That's energy. So everything is energy. When we go to the doctors for an ultrasound, that's energy. When we have an MRI scan, that's energy. When we call each other on the phone, that's energy. And this is the same thing with the frequency medicine, because people say, well, how do you get into my body when you're here and I'm there? And I'm
Yeah.
like, well, just as I'm talking to you on the phone, you create a personal energy signature and it dials into your energy. And then it, as an MRI scan does, and with MRI, it reflects back with a picture. And here we reflect back with a frequency.
Yeah.
They're very
Because
intuitive.
it is really, I mean, you and I understand because we have been doing this for a long time, but it is very difficult for someone who's new, or even sometimes people may be coming to you, have been using it, still don't understand. It is working for them and they are just fine with that idea that, okay, it is working for me. I don't want to know anything more. But it is about how to get that idea into people's head, right? For example, I give you example in my work of fertility especially. So women are talking about, it's a big thing about improving the eggs, the quality of the eggs. So it's like huge thing. And where I am coming from, I say to them, without improving your health, there is no chance of your equality improving. You know, and that seems to be like I'm talking totally alien language for somebody who's hearing me first time, because they're like, but I'm taking medicine, doctor is giving me hormones, yeah, and they don't understand that how their own energy is playing into this whole thing about health.
The other thing is about energy is it's a mindset as well. I mean, I was listening to something the other day and they said that people who have a positive mindset recover from illness quicker and they don't get sick as much. And it's so
100%.
true. And I know this from people who I know in my personal life, as well as patients. And it's one of the things that I really work on with people so that they are their own motivation system. They have to be master of their own mind. I believe in the law of attraction, all of those things. But all of that has been proven by science. It works.
So what is
When
your argument to when even doctors say, so many people say, but there's no evidence. Even for herbal medicine, they say there's no evidence. Anybody who says there's no evidence, I'm like, I'm not interested in talking to you because you have been living in a cave. What do you mean there is no evidence? There are thousands and thousands of studies and papers to, even on energy medicine, everything.
Well, I would say there's a difference between having evidence and you having read it, because there is evidence, they just haven't read it.
Yes, true.
Because
That's what
the
I
yeah,
say.
evidence is there, and I've been in practice for over 20 years, and the evidence is walking and talking around London, Toronto, and Malaga. It works. Um, even from my own experience, I think it was last year or the year before, I decided I was going to investigate HRT because I was getting the symptoms of the hot flashes. But my mindset had been so strong about the menopause that I didn't even want to enter it, because I think once you put yourself with a label, you become the problem. But it got
Yeah.
to the point where I was literally sweating. I mean, I wasn't glowing, I was sweating. And I just thought, I'm going to investigate. And I wanted to try the biochemical, bioidentical hormone.
Bioidentical hormones. Yeah.
I had to go for all these different tests, and the next thing I had two elevated markers for cancer. I had profound stage 4 endometriosis. I had ovarian cyst. I had all these things that I didn't know I had. What's weird was that a couple of months earlier, I'd been playing around with the scan on myself, and all of these things had come up as issues. And I thought, oh my God, I'm a fraud. This machine is rubbish. It's saying I've got endometriosis, I haven't got that. It's saying I've got ovarian cysts, I haven't got that. And it's because, anyway, I have cured myself with frequency medicine. Even the gynecologist and she's done, the physical ultrasound and measured them.
Yeah.
She said one of the ovarian cysts has gone, the biggest one has got smaller, and the lining of the endometrium is smaller as well. The cancer markers have gone. I went to the endocrinologist and she said, your blood test results are phenomenal. What have you been doing? And I said, I put myself in my own clinic as a patient.
I treated my I consulted myself and I treated myself.
did. I did. I sat there and I thought, what would you do as a patient? And I mapped out all the body systems, what was impacting on where. And, I have a complex medical history. The osteomyelitis as a child was the least of it. That's isolated to a hip joint and that was replaced. But I got diagnosed with Hashimoto's, and as you know, that affects everything.
Yeah.
Um, she said, everything is just amazingly well managed. So
That's
it shows you can do it if you want
That's
to.
a great testimony coming from own practitioners. But no, I have had doctors in the past where they said, "Oh, we have this issue, but I can't openly consult you because I'm an NHS doctor and I cannot come to see you that I have diabetes." This is now going back years and years.
Yeah,
Uh,
I've got patients who are NHS nurses that they've said their blood sugar results have never been better.
yeah,
Yeah, I think the stigma's going. I think people are, if you're a good doctor, I mean, even Einstein said, medicine is frequency. Frequency.
100%. And I think mind is such a huge part of this, and that's the other thing that um, we don't understand, and or people don't understand that. Okay, they say no, but I can do the therapies. Let's not do the the mind part, or the visualizations, or the and for me everything starts from the mind, right? So your body is following your mind. And it is so crucial for this part, and it's not mind is not only in the brain. Mind is everywhere in your body, and how you deal with it. But it is, oh, yes, you're right. More and more people are coming out and using therapies. As you and I know, there is more interest in it. But I still find that what is happening is more and more people are coming out, but they are looking for a pill. You
Yeah.
know, they're looking for, can I
Quick.
take a pill to improve my fertility? And I'm like, no, you are the pill.
So true. But also,
Right.
I think you've probably learned this yourself. People who are their own barrier to health. The yes, but I'll say, well, why don't you do this? Yes, but I can't do that because of this. And eventually, you go through all the options. And I say to them, right, well, your homework's really simple this week. I just want you to go home with a question, and as and when I see you next, you can give me the answer. And my question is, what have you got to lose by gaining your health?
Yeah.
Because they are their own barrier. And with one particular lady, she said eventually, attention. So she got a lot of attention being
Yeah,
sick.
yeah, yeah. The victim mode.
Yeah, so then we got into the psychology of positive attention and negative attention. And is
Mm.
she the kind of person she would want to spend time with as a husband or wife? And how is that impacting on her marriage and her work? And she is a different woman now. She is a different woman.
That's just crazy. And you're right. That's the thing. They will lose their identity because most people are associating them with this disease, or this person with this disease. That becomes your identity, and then you think, oh, then nobody is going to even look at me because they know now I'm healthy. I don't need their support. Um, and that is also is a huge part. I know this personally also with family members who were like that. And that is where mind is so crucial in whole health scenario, as the biggest driver, which people don't realize. uh, you know And also they realize that, okay, even if they do realize, they realize for short term, like they're coming to you, coming to me for shorter term for a little bit of work. And as long as they either get pregnant or the one health issue they solved it, they just go away and again get lost in their own mind and not optimizing it daily, because we need to optimize our health daily. It is not something that we can just do it on a 3 month basis. 3 months is just a kickstarter to start you off, but that doesn't mean that you can then forget about it.
No. Yeah, that's why I'm working at the moment on a transformational program, and I'm just tweaking it together, whether it will be 10 weeks or 12 weeks, to kind of help them get into a habit to do the work on themselves. And it's something I'm working on at the moment because
Yeah.
I think we all need it. I mean, I invest in my own self care, and I'm not just talking from a medical point of view, but as a practitioner, I'm a very reflexive practitioner, and I often check in with myself and my level of empathy, and where am I with it, um, so that the patient gets the best out of me as well. Because
Yes.
I think a lot of the time you know all these things, and it's very easy to write a prescription for different things. But I never want to lose sight of the fact that I'm dealing with a person.
Mm.
I recently, in my personal life, had to help an old friend who had a terrible crisis, and the police were involved, and the person was completely innocent, but as the police they have to conduct the investigation from start to finish. But in the process of this investigation they lost sight of the fact that they were dealing with a person,
Yeah.
because they are so busy with the evidence. And ultimately this person who is and was always completely innocent has now developed psychosis, and he is beyond recognition, because of their incompetence, the length of time they took, their lack of communication.
Yeah.
And, he said, my head is broken now. And I said, yes, it is. And I said, because it's post traumatic stress, but you will be better. And I said, you don't need to worry about the how today. Just know that day by day, you will get better. And the reason why I'm mentioning this is that I think it can happen with practitioners and doctors, that they lose sight of the person in front of them. And I never want to be that kind of person that
No.
doesn't empathize and understand.
Hmm.
As much as I sometimes have to give them a boot up the to get them
Oh,
going.
we have to do that. We have to do that for ourselves as well, because it is also a known fact that healthcare providers themselves are the most stressed out people on the
Yeah,
planet. Doctors are overworked, nurses are certainly 100% overworked, and how their health is, um, and definitely. And I know so many people in social circles who are doctors and who are not healthy, themselves. I mean, now it's getting better. I think the younger generation is getting better, where they're looking after themselves and very much on board. But older generation, I know so many doctors drink, smoke, eat, whatever, unhealthy, weight, and all sorts of things. So it's crucial to, I cannot do any work if I am not walking, talking the way I want my patient to. If I can't sleep on time, I can't expect my patient to sleep on time. If I can't do
no,
breathing exercises, and also don't know how it would feel if I've actually done 3, 4, 5 minutes of pranayam, I will not be able to recommend that to my patient, because I would not have a clue how it's going to feel like. And I think
exactly.
that disconnect is so much when doctor is giving a prescription, where they're not going to deal with the side effects of that prescription. You know
No, and also it's teaching them to manage the side effects as well.
what do you mean?
Well, for instance, like if you were going to give somebody, high dose niacin and you get the niacin flush, then you need to teach them how to take it properly and manage the symptoms.
Yeah,
And,
yeah,
and another one example is if when people have candida, and it's called the healing crisis, where you'll have candida die off because the cells are breaking open, it's releasing toxins. So you
yeah.
need to support them with the liver and hydration. It's funny actually. I was thinking about this the other day, how my practice has kind of evolved. So the psychology has always been the focus, But then with the nutrition, you always focus on the gut because 75% of the immune system's held there. But
Yeah.
now I think with 20 years of experience and the people and all of that, my view of what is health has totally changed. So now if people were to say, well, what are the essentials? In the old days, it would be, oh, healthy diet and exercise. And now my spin is completely different. It's hydration number one, because
Right.
without hydration, nothing works.
Hmm.
The second one would be emotional health, emotional and mental health.
Yeah.
And then it would be nutrition, then it would be exercise, and then it would be detoxification. And
Yeah.
detoxification is not limited to alcohol and obviously not drugs, because that's not something I do. But it's not limited to the obvious. It's detoxifying your life, getting rid of the energy drains, getting rid of the clutter in the house, the bad relationships, the job that's draining you and you're not happy. All of these things. And I just think that to me is what health is.
That's great summary as to, and you're right. It is health is not. Most people think I'm taking the supplements, I'm very healthy, and not
Yeah.
realizing that if gut is not digesting those supplements, they are a total waste. As well as when you are in a positive state of mind, your gut digests better, right?
Yeah.
So we
It's the
know
same
this.
brain.
Yeah. So
It's the
when
same.
you are in positive state of mind, your immune system works better. So and that's why you can't work on one single thing. You have to come from a holistic perspective and support all different, whichever leg is missing of that, your structure, you need to support all those legs. And they all work they're entangled with each other, they work with each other synergistically, and that's why we need support on all those areas, which makes it, of course, very very complex. But yeah, that's the message we are giving out to people. Everybody who's listening now and will listen afterwards to the replay is to do more, do better, do natural, something which is gently supporting your health, and not just taking one single supplement thinking that you've done the best for your health, which you probably haven't. You haven't even started.
Well, they say it's not what you eat, it's what you absorb.
100%. Yes, we say that in Ayurveda, it's not what you eat, but what your gut can digest and absorb and assimilate is the nutrition that you're going to get. So tell me um, what else? What is the new thing that you're working on? You said the program that you're developing, 10-12 week program.
Yeah, that's what I do, because I do corporate workshops as well. I have the my two signature workshops. The first one is Eat Well, Be Well,
Mhm.
and that kind of helps people to realize what health is and how what you eat affects you, but also how you eat. Not to have loads of fluids with meals, to sit down when you're relaxed, all of these things. And then I teach them a bit about supermarket savvy, what to put on in your trolley and what to leave on the shelf. And
Mhm.
it's very interactive. I get people to do a 3-day food diary, and I give them an idea on how to balance their blood sugar levels, what supplements are good for, as a kind of basic elementary level. And
Yeah.
then the other workshop is Think Well, Feel Well. And that's all about life assessment, having a look at your life, what's working for you, what isn't,
Mhm.
various exercises. Again, it's very interactive. And then teaching people to kind of manage their mental and emotional health, because
Right.
again, 95% of it causes your disease.
100%. That's great. And you, as you mentioned, you go around corporate companies around the world, right?
Yes.
Yeah.
Yeah. Yeah.
Okay. And how is that? I mean, what is their attitude? Because I don't work much with corporates. So how is their attitude? How it is changing?
Well, they've noticed that they've kind of made it a bit of it into competition. A lot of them. I worked for Brita Water, and they started setting up these different competitions amongst their teams. Well, who was doing the challenges, and they made it quite competitive. So they really got into it. And I think it kind of, because I try and do smaller groups as well, they kind of bond together as well. They get to know each other a bit better, rather than just being at work. Their personalities come into it a bit more, their personal worlds.
Yeah. So they're doing a bit more, men and women equally.
Yeah,
Yeah. Yeah.
I think
And also
men. Mhm.
seeing the difference. Yeah.
Yeah. And it's the
Okay.
same with weight loss. I have to identify what is their motivation. A
Mm.
lady who's not remotely interested in fashion is not going to be motivated by a new wardrobe, but she might be if she can get herself off the list for back surgery. Same with men. If they're going to be starting on the dating scene, they want to feel more confidence. Um, Notwithstanding the fact that, being obese, you're 80% more likely to get diabetes. That it's the same with the cigarette smokers on the packet, this kills you. Well, that doesn't stop them lighting up because it's not
No.
motivating them. The
Yeah.
money, right? I don't know how much it is a packet. I think it's 12 or 15. I'm really out of touch.
No idea. I don't smoke.
No, it's very, but I know I mean, I think that's why a lot of people in Spain, they buy the cartons here because it's cheaper, but it's, that might be a motivating factor for someone to stop smoking, the expense rather than the picture of the damaged lung.
Yeah, yeah. I think all of this, the bottom line is it's subjective to the person. One person's motivation is not other person's motivation. One person's of health or how their fitness level is not same as the other one, and everybody is so unique. And that is why the idea of subjective medicine, which has always been there with Ayurvedic medicine, that every person. I mean, I've got twins, and they're two completely different people, right? So if they are not going to be alike, there is no chance of two different people to be alike in any sense. So
No.
that is, I think, the message is to look at your individual requirements, your mind, your health, your gut, and then do things accordingly for what works for you. And in the beginning it is a trial and error to see, okay, this works, this doesn't work, and to then come with the blueprint for yourself that work. Like, I know a blueprint that works for me. Breakfast is the key thing. Without it I cannot function. Right.
Well, one of the questions I often ask at the end of a first consultation is I've gone through all of their history and where they are and what brought them up to this point, and then I give them some guidelines to kind of get going. And then I'll say to them, how motivated on a scale of 1 to 12 are you to kind of get better? And then I'll say, and how confident are you that you can do
Mhm.
that? Because then I know where I'm working. Is it they just don't give a damn, or is it that they doubt themselves that they can do it? Then I know which way to kind of steer them a bit, because it
Yeah.
is about motivation and confidence.
It is all. I think the whole life is about that, and health is part of that. If you're motivated to move and shift, you can shift mountains if you're motivated. And if you're not motivated, you can have all the things lying in front of you, and you will not be interested in that. So that is wonderful discussion. We can go on and carry on, even though we started a little bit late. Thank you, Janine. It's good to know. I always love the interaction and, having a discussion with other practitioners who are also working in the similar field and working with the integrated idea of integrated medicine and on themselves as well as their patients. Is just wonderful to hear.
Yes. Well, thank you so much for having me.
You're very, very welcome. And you have a busy day today in clinic.
Yes,
Is Friday going?
yes. I love to be busy, and if I'm not working, I'm learning.
That's a good way. Yes. Well, we are connected, and we'll do more of this. This is a live show which I'm hoping to continue doing this so that we can give put a long format out videos. This is going to go going directly on YouTube as well, so that people can learn and can connect, and something starts churning in their own head, something starts clicking in their own head, and they can reach out to you or me, depending whoever they want to reach out to.
Yes. Well, thank you again. I really have enjoyed this wonderful opportunity.
Thank you so much, Janine. And thank you, everybody. And feel free to connect with Janine or with me. And also, any other questions, if you have, or if you have enjoyed, you can just, give us thumbs up as well. Thank you so much. Until next week.
Thank you very much. Bye bye.
Bye.